Welcome to our channel Medico's Learning Decks. Here we will discuss easy mnemonics, high yield topics, and integrated revision of topics related to medicine. So let's start. So today's topic is Glasgow Coma Scale. Let's start. Glasgow's Coma Scale is actually used to describe the general level of consciousness. That is the level of consciousness. Mostly it is used in traumatic brain injury patients so as to diagnose the level of consciousness in the patients. So three categories of this scale are, that is eye opening, motor response and verbal response. Each score has a minimum score of 3 and a maximum score of 15. So total GCS score has maximum score of 15 and minimum score of 3. So first let's define what is consciousness. Okay, so consciousness is defined as being the state of being aware of the physical events or the mental concepts. That is being aware of the surroundings. So this level of consciousness is also related with the degree of arousal and the awareness of the surroundings. So altered consciousness can denote underlying brain function. So GCS we are using to determine the consciousness level. So if GCS is poor, we can say that altered consciousness is present. So that might determine an underlying brain dysfunction. Now causes of altered consciousness may be that might be, one is profound hypoxemia, then hypercapnia, that is abnormally elevated CO2 levels, then cerebral hypoperfusion, and other also causes like strokes, convulsions, hypoglycemia, any drug overdose, then alcohol intoxication or any hemorrhage. So all this can lead to altered consciousness in a patient. So that will lead to decreased GCS score. So now let's come to the GCS score. Three responses are measured. That is, one is motor, then is verbal, then is eye opening. In motor, maximum score is of 6, then verbal is 5 and eye opening is of 4. So total score will be 15. Now these are the three components: eye movement, motor response, verbal response. So the mnemonic is EVM. Now what are there in eye response, verbal response and motor response? First, in eye response is spontaneous, that is there is spontaneous eye opening, opens to verbal command is 3, then is opens to pen and none, that is no response to the no response is noted. So here the eye response maximum score is of 5 and minimum is of 1. Then coming to verbal response. First is oriented, that is totally oriented to the surroundings. Then is confused, then inappropriate, then comes incomprehensible words, then come row response. So the minimum score is of 1 in verbal response and maximum is of 5. Then come motor responses. Okay, in motor response, first is obeys command, then purposeful movement to pain is there, withdraws from pain, then is flexion or decorticate posturing, then is extension or decerebrate posturing, and then there is no response. So minimum is of 1 and maximum is of 6 in motor response. So the minimum score of GCS is 3 and maximum is of 15. Okay, so if no eye response is there, no verbal response is there, no motor response is there, so that is 1 plus 1 plus 1, that is 3. And if highest responses are there, So then 4 plus 5 plus 6 is equal to 15. So highest response is of 15, lowest is of 3. Lowest is of 3. Now another revised GCS has been done. Revised GCS has been done in 2018, in which in addition to these three components, another component has been added, that is eye-opening, verbal response, motor response, and to that what has been added is pupillary reactivity score. Pupillary reactivity score, which is also known as GCSP. GCSP. So this is the update now. Okay, this is the update. Now if pupil is non-reactive, if both the eyes are non-reactive, the score is given 2. If one is non-reactive, score is given 1. None is non-reactive, then the score is 0. In GCSP, this P score you have to minus it from the total GCS score. That is, suppose GCS is coming as 15, then both the pupils are non-reactive, then minus 2 it will be, that is 13. Then if both none of the pupils are non-reactive, that is both the pupils are reactive to light, then 15 minus 0 is equal to 15. So GCS P score varies from 1 to 15. GCS score will vary from 3 to 15, but GCS P score varies from 1 to 15. This has to be reminded. And then another is GCS PACT. GCS PACT. What is that? GCS plus pupil plus the age plus CT finding. So this is also a new update. GCS PACT. Okay. Then for non-testable parameters, NT is written. That is, suppose the patient is intubated, so there won't be any verbal response. Verbal response won't be there. That is, it is not being able to be tested. So we will write, suppose I score of 1, V score NT, then motor response of suppose 4 or 5. So this is NT denotes non-testable parameter. Okay. Now another question comes in entrance exams, that is the best predictor of outcome. The best predictor of outcome in the GCS is the motor response. The motor response gives the best predictor of the outcome in the GCS score. In GCS PA, we already discussed GCA PA. The age of the patient is also calculated. The age of the patient is also calculated. So the younger the age of the patient will be, the better the prognosis. Now GCSP we already discussed. Here we check how many pupils are non-reactive to light. So here light source is being given to the pupils. Both are dilated. That is, both the pupils do not constrict to light. So both the pupils are unreactive. Score is given of 2. Then one pupil constricts, another pupil does not. So score is given of 1. Then both the pupils are constricting to light. So both the pupils are reactive. So the score is given of 0. Now here comes the mnemonic, how to remember all this scoring for GCS scale. Okay. First coming to the eye component. Okay, eye component. The mnemonic is SSPN. So S is spontaneous eye opening, that is score of 4. Then to sound, that is 3. Then to pain, that is 2. Then nil or none, 1. So SSPN is the eye movement. Eye movement mnemonic is SSPN. So let's repeat once again. First is spontaneous eye movement is there. Second is to sound, eye opening to sound. Then eye opening to pain. Then nil, that is no eye movement is there, no eye response is there. Next comes the verbal response, that is vocaine. So V for verbal response, then O is oriented, C is for confused, A is for appropriate nahi hai, so inappropriate. Just this part you all should note that this part we have reversed the sentence so as to form a mnemonic. Appropriate nahi hai in Hindi means no, so inappropriate. Then comes incomprehensible sounds. So and N is nil. So the verbal responses, the mnemonic is vocaine. First V for verbal response, O is for orientation, that is score of 5. Then is confused, that is score of 4. Then appropriate nahi hai, that is score of 3. Then incomprehensible, that is score of 2. Then nil, that is score of 1. Okay. Now comes motor response. So motor response, the mnemonic is old Ben. So first is O, that is obeys command. Here the score of 6. Then localizes pain, the score of 5. Then draws or withdraws, that is withdraws from pain, that is score of 4. Then come bend, old bend. B for bend, that is flexion, also known as the decorticate position. So that has a score of 3. Then E for extension, that is decerebrate positioning, that is score of 2. Then is nil, that is no responses recorded, that is 1. So for motor response, again let's repeat. The mnemonic is old Ben. First is O, that is obeys command, 6. L is for localizes pain, that is 5. D is withdraws from pain, that is 4. Then come B, bends or flexion, that is 3. E is for extension, that is score of 2. Then N is for nil, that is score of 1. Now let's see practically how do we apply the GCS scale. So suppose a patient comes, we need to calculate the GCS score, right? So our components are E, V and M. So first is E, that is eye response, we will see. Okay. So unprompted or spontaneous eye opening is there, so score of 4. If the patient, we ask open your eyes, so the patient opens the eyes to speech, so that is score of 3. Then we give the patient, we give a pain stimulus, that is by trapezius squeeze or supraorbital pressure, that is eyes open to pain, so score of 2. Then even after pain stimulus also no eye opening is there, so no response, that is score of 1. So how to give a trapezius squeeze or a supraorbital pressure? See, here we give a pressure, firm pressure and in the trapezius muscle, or we give at the supraorbital region. So these are the two painful stimulus given for eye opening. So what was our mnemonic for this? For E it was SSPN, right? So first is spontaneous, then to speech, then to pain, another is no response on nil. So 4, 3, 2, 1. Okay, maximum score of 4, minimum score of 1. Now next come verbal response, right? Next come verbal response, V. So what we asked first, the orientation of the patient. We asked who are you, where are you right now, why are you here. So if the patient answers everything correctly, we give a score of 5. That is oriented, The patient is oriented to time, place and person. Okay, so what then next, if not all are correct but gives at least inaccurate responses but able to talk in sentences, so the patient appears confused, so score is given of 4. Then inappropriate words are there, that is not complete sentences are there but some random words which are muddled, so the score of 3 is given. Then next come, if the patient does not give any clear words or a clear sentence, only moaning or any groans are present, so score of 2. Then no response is there, score of 1. Okay, so for verbal response, what was the mnemonic? Mnemonic was vocaine, right? Vocaine. So V was for the verbal response, then O is orientation, that is 5. Then C is confused, that is score of 4. Then A is appropriate nahi hai, so inappropriate, score of 3. Then I, vocaine, I is incomprehensible sounds, that is score of 2. Then N is nil, so score of 1. So vocaine is for verbal response. Okay, now comes the motor response. Next comes the motor response. So for motor response, we give the patient some simple verbal commands, like suppose lift up your arms or show me your tongue or hold the thumb. So all these verbal commands are given to check the motor response. So if the person obeys the command, the score of 6 is given. Suppose the person does not obey the command but tries to remove the oxygen mask, tries to do something, so that is score of 5. Okay, then if the patient, that is localizes to the pain stimulus, that is pain stimulus is given and the patient can localize towards that pain stimulus, that is score of 5. Then is withdrawals, these two are same only. So now then, if the patient withdraws from pain, that is flexes the arm towards the source of pain, but he cannot properly localize the source of pain, that is cannot remove your arm, remove the arm of the examiner causing the pain stimulus, so withdrawal from pain is there, that is score of 4. Then abnormal flexion, that is patient flexes the arm and rotates the wrist, so score of 3 is given. Then abnormal extension, that is in painful stimulus the patient straightens the arm at the elbow and rotates the arm inwards, that is extension, that is score of 2 is given. Then no response, score of 1. So for motor response, what was the mnemonic? Old Ben, right? So first is obeys command, that is 6. O. L is for localizes pen, so score of 5. Then D is draws or withdraws, from pain, so score of 4. Then Ben, BEN, so B is bends, that is flexion movement. E is extension, that is extension of the arms. Then N is no response. Okay, no response. So now see the let's see this flexion and extension position, decorticate and decerebrate position. See, this posturing decorticate and this is decerebrate, that is BEN we had, no? So B is for this flexion and E is for this extension or decerebrate positioning. So in bending, what they will do, the arms are like C, that is there is flexion in the arm, and in decerebrate there is extension of the arm. So see here in decerebrate there are two E's, right? There are two E's, so extension. Remember like this, there are many E's in this, so it is extension. And here many C's are there in decorticate, so arms are like arms are like C, okay, bended like C. So this is bends or withdraws, that is flexion in the flexion in response to pain, and this is extension in response to pain. So this is decorticate position, that is decerebrate position. See here again, decorticate position, that is arms are held in flexion, and internal rotation is there, okay. So arms to the core is decorticate. Then decerebrate is arms are held in extension, and internal rotation is there at the wrist joint. So this is decerebrate. Decerebrate is extension. See, all E. Therefore extension. Arms are held in extension.
Thank you for watching. I hope you found this video helpful. Do like, share and subscribe to this channel to get more videos of this kind.